Of course, the two big questions nearly everyone has are when will this peak and when will it end? Tonight, we have a better idea of what state officials are following with the COVID-19 models. Bottom line, it's going to be a while. Sit on your side, Stephanie Harris has this story for us. Steph?
Anita, in fact, the state health secretary said, we're in this for the long haul. Here's what we learned today from researchers at the University of Virginia Biocomplexity Institute, who've been tracking and projecting the numbers. Here are the models from UVA, and the good news is
the current social distancing efforts seem to be working.
Researcher Brian Lewis describes it as putting the virus on pause, but it's basically just pushing the ball down the court. Their projections put the peak now at mid-August for Virginia. What you see in pink is the projection if on June 10th we go back to halfway normal lifestyles.
What half means exactly is difficult to fully describe, but in this current situation, we've got a lot of folks staying at home, not doing a lot.
By UVA calculations, Virginia hospitals have enough resources for at least the next 2 months, but hospitals would reach capacity in the fall.
We definitely need to develop a different toolkit besides open everything up or open it halfway.
Health Secretary Dan Carey says some strategies could include complex antibody testing to see who's already been infected, or temperature assessments to determine who's allowed to go back to work.
And how to do that in a complex open society like the U.S. and in Virginia in a nuanced and responsible way. We've got to develop that.
That, he says, is what they'll be figuring out between now and August to avoid ever getting to this curve.
We don't have this all figured out. There's not a toolkit developed yet at the federal level, but we are looking at what those tools are.
He also said it's important to note that no models can tell us exactly what will happen, but as new data and better data become available every single day, the models get better too. And the experts say keep on social distancing, washing your hands, and wearing your masks in public in the meantime. Stephanie Harris, 10 on your side.